Wellness intervention in public health. I'm sure one thing that we all agree on is that every resident of the Commonwealth has a basic human right to quality, affordable health care. And I know we're very proud that we are closer to that goal than any other state in the nation, and that's something we all celebrate. That said, all the great progress that we have made is threatened by the unsustainable rise in healthcare costs and the large disparities in access to care and quality of care that still exist in the state. So we understand that the next phase of healthcare reform, which we are embarking on very shortly, really what that needs to do is move us from a sick care system to a well care system. And that's why focusing on prevention and wellness is such an essential element of how we need to transform our healthcare system. So let me say a few words about the proposal that we've put before the legislature and where it is now. The idea of a prevention and cost control trust is really to create a robust and sustainable funding stream to support all of the great community-based prevention efforts that are already underway. We were reminded again just yesterday when the House Ways and Means Committee released its budget, and we know the legislature and the governor are operating under very difficult economic circumstances that continue. But once again, we see that local aid and K-12 education, homelessness prevention, very important programs, but those are the ones that tend to get prioritized. And investments in public health and prevention, unfortunately, tend to get the short end of the stick. And that's really the essence of why we need a robust, sustainable funding stream. We know what works. Shape Up Somerville is an amazing example of what can happen. Fun in Fitchburg is another great example. We've got these terrific programs, many of them supported by the wonderful work of our Department of Public Health and the Mass in Motion program that Governor Patrick and Secretary Bigby and Commissioner Auerbach put in place several years ago. And just 1,000 flowers blooming all around the state. And these programs are showing results. They're putting healthier food into our schools. They're getting our kids to engage in more physical activity and physical education. Our restaurants are offering healthier options. We're building more sidewalks, safe routes to school, safer playgrounds and parks for recreation. We know what works. The challenge is we have to scale these up because we need to get these kinds of interventions widespread across our communities. And that's what the Prevention and Cost Control Trust can do. It would be administered by an advisory board led by the Commissioner of the Department of Public Health. They would be, every year they would update the list of conditions that are the most preventable and that are the most costly. So we would be focusing our resources on the areas where we can have the biggest bang for our buck. And then they would make grants, competitive grants, either directly to municipalities or to regional organizations where nonprofits can play a role. And these wouldn't just be mini grants or pilots. These would be a way to scale up these programs that have already proven that they are effective and that they work. And that's how we can have a very significant impact in moving from a sick care system to a well care system. We would work in partnership with our hospitals and our community health centers. As we heard from Steve about Bay State and the great work they're doing, and many of our community hospitals are doing this kind of work already and want to do more of it. So this is exactly where they want to move. We do need to make sure that the trust is adequately financed. The mechanism that we have proposed in the legislation would require a modest assessment on our health safety net payers, which is our insurers. And it's really the same way that we pay for pediatric immunizations. The concept being it's a public good. We want every child to be immunized. Same thing here. It's a public good. We want everybody to have the access to make healthy choices. And the beneficiaries of that are all of us, the public, but most directly it's our insurers that will benefit from that. And we're seeing evidence that the return on investment doesn't take years and years and years, that in a relatively quick time frame, these kinds of interventions, when they can impact the rate of obesity, diabetes, heart disease, stroke, that we see a very near-term return on investment from these interventions. Just 2 weeks ago, like Susan, the Mass Health Council held a terrific event on the ROI from prevention and showed for a number of different cases, asthma, tobacco, and others, where we have very solid research now showing us that not only does prevention improve quality of life and productivity, but it also saves healthcare dollars in a relatively short time frame. So we're not wedded to that particular funding mechanism, but we need to all advocate for sufficient funding for the trust so that it can do the important work that we need it to do. I'll just wrap up by saying that it's really gratifying to see the progress that we've already made this legislative session, and it's no accident. It's the hard work of the coalition and my colleagues who are in this room, and Senator Chandler, who's been amazing on these issues for a long time. People are talking about prevention in a way that I don't know that they were as much before, and they're hearing us. We, the coalition, released a letter to the leadership signed by more than 300, leaders in our business community, our civic community, our healthcare leaders, all bringing the same message that prevention needs to be a critical piece of payment reform. And then just more recently, Representative Kulik and I asked our House colleagues to join us in a similar letter to Speaker DeLeo and Chairman Walsh, again, the need for a sustainable, robust funding stream for prevention in payment reform. And we had 49 of our colleagues join us on that. That's remarkable, given the tough economic times we're in and all of the many worthy programs out there that are seeking funding. We got that kind of support. So I think that tells us very clearly that there are many people who get it. We're so close to the goal line. The legislation is going to come out of the Healthcare Financing Committee very soon. It will be debated in the Senate probably first and then the House. So we need to just get that final yard. So this is where we need everybody in the room. This is not the time to take a deep breath and relax. This is the time to push hard, speak to your own legislators, speak to leadership in the House and Senate, reinforce the importance of having a robust, sustainable funding mechanism tied into our healthcare financing system for prevention in payment reform. That's how we will transform our system into a well-care system that provides quality, affordable care for all of our residents. Thank you all so much.